maternal and child health, but I think we have to give them good vision, and that's our aim of ICO and AOS. And next I invite any questions you want to ask, anybody? Okay. And next I invite Prasanna Venkatesh Ramesh to speak on my unfiltered ocular journey, timeless grit, self-discovery and joy voyage.
At the outset, I would like to thank Natarajan sir, who has been part of my journey as well in 2021, when I had an innovation and approach sir. And this is going to be more of a young ophthalmologist journey into the field of innovation. And I'm still learning as we speak. Can I have the view here as the mirror image view? Yeah, the view in the screen. Thank you. So I am into innovations, and this is going to be my journey on innovations and how I started my own startup as well. And sir, I have also taken my ICO exams, both advanced ones as well as they had a ICO glaucoma subspecialty exams when we started last time, at least in 2019. So I'm very grateful to share this podium with such doyences in the field of ophthalmology. For me, my journey started in 2015. Or rather 2010, and I was more keen into these advanced innovations of science fiction movies, which I always tend to celebrate in my mind in a very cognitive way. And these are some of the movies which really inspired me, and I'm a millennial, and this was one of my photographs which I edited in the year 2009, 2008, when there was not much of editing softwares. I had to sit and edit. I wanted only my shirt to be green in color. So I was more of a filmmaking guy when I was in my undergraduate days. That is the red guy, red shirt guy is me, where you can see, can I have a pointer? So I was into a lot of photography, videography, and this was one of my movies, After Effects, that I made. So I was into a lot of video editing from 2008 when these technology was not available in our country. And even the small dots that you are seeing in this particular screen, it was actually made by myself. So it had different layers, and these were some of the things that I started my journey in 2010, and this was my film which I was a teenager at that time. I wanted to make this videography into vision, and that is when I started applying the same in ophthalmology, because you have to get serious, right? So I started learning these tools when I was an undergraduate student, and these are some of my award-winning images that I participated in the ASCRS. You can see we specialize in every imaging that you can see, be it gonio, microscopic or holograms, or even this is one image that I always very fond of. It's a monochromatic fundus photograph of an FFA of a normal disc. And this is a Decimens membrane detachment that you can see. This was one of the images, After Effects category. A patient's pupil was converted into a flower. This was a fibrin membrane, so you can see there was no end to creativity. I started applying my creativity into the field of ophthalmology and started giving it layers. You can see this one particular image here, MMC bleb was taken in diffuse cobalt blue filter, and then you can see it in ASOCT and Scheimpflug imaging. So, and again, if you are going to see a pseudo bleb, the septae of all the annotations. So I started bringing my filmmaking thing that I learned, which my parents were very afraid that I might not take up ophthalmology, sir. But then I had to slowly take the passion for imaging, videographic imaging that for matter. And this image was published in the American Academy of Ophthalmology in the cover image, an Axenfeld-Rieger syndrome. And again, these are some of the photographs that started me into the journey of ophthalmic photography. I'm not going into the depth of all the photographs, but I wanted to show you how I captured each, because that is how my passion entered into the photography. So all these photographs are my own images, and I tend to capture. This is a lone wolf that I coined, one of the Sturge-Weber patients which had this, and this is a colobomatous eye as well. And you can see all are complex photographs. I have a story between this one photograph here. When I was operating, it was a clean rhexis, but my side ports were not that great, one of my earlier cases. And the iris started going on either side as a prolapse, and I was able to see an eye within the eye. So these are some of the collections I even tried to recreate, but I was not able to. It just happened on that day, and I just mirrored it. It looked like an eye speaking to me on a tissue level plane. So right, so these are the photographs, and I have a huge number of collections of these photographs. As I told you, I have published extensively from the regional journal to the American Academy. This is my image on the AAO cover, and I also published on IJO cover, and I'm very keen. I converted this into publications, and most of the journals has my photographs, to name a few, including our own Yo Times, which we had in Cochin as well. So this is how it started for me, and imaging videos was how it really started for me. Appa also recognized my talent along with Nadarajan sir here. Consistently in the last 4 years, I have able to make an impact in APAO for the photography category. And I wanted to move further. It was not only photographs or a video based one. That was when I wanted this thought of holograms, and this was the 6th cognitive thinking that went into my mind. Can I do this? Because I was doing a lot of photography, but that was not enough, and that propelled me to make 2D animations. So me being a glaucomatologist started making animations in a very simple way of what is an iris process, what is a peripheral anterior synecdoche. Because today a young ophthalmologist or me trying to teach what is an iris process and what is a peripheral anterior synecdoche is day 1 of glaucoma curriculum. And once you make an animation and show them, now when they do gonio, they know that iris process is fine, whereas a PAS is more broad basal. So I started videographic application and started converting it into more of practical things. Like this is a 10-second video where a pupillary block is shown, where the cause happens here, but the effect happens here. The cause happens in around this region, in the iris and the lenticular plane. I'm just playing this video once again. So my whole idea was, can we start the curriculum as an image video based curriculum where the pupillary block happens here, the acute attack happens here. So this is how my journey started, and the YouTube, there was never a YAG-PI video, sir. When I shot my first video in 2019, there was not a clear video on YAG-PI. So the pedagogical boundaries were pushed. So this was one of the YAG-PI videos that was published in a high definition, and you can see that the photo disruption is beautifully seen here. I used a slow motion camera to catch the photo disruption, and you can see, even I'm just going back here, just like the Tenet movie. Now you can see the bubble starts coming, right? See how the bubble starts coming and it goes to the 12 o'clock position. Look at the gush of aqueous. I'm just going back here and it's all back to normal. So the idea was to keep pushing boundaries, and we just came from a teacher's session from below. And this is another video of mine where I have not used an Abraham lens, but you can see the photo disruption here. So this is how photo disruption looks in a phone camera, a smartphone camera. So can we really show concepts of photo disruption, what it is, for the neophytes to understand this so that it really helps them much better in teaching? Was one that I got inspired by Professor Dr. Nadarajan sir. And this was one of the video of a glaucoma patient. In 1 minute, can you show what is glaucoma? This is a 1 minute video where first we show the cup disc ratio, we zoom in, because less is more is what today's youngsters are moving in, as Prajana sir was also talking in the below session. Everybody wants more information in less amount of time. So I'm giving them bionetting sign, then I'm showing them ISNT rule is breached, and then I'm just zooming out. One image, I made everything possible. All these are my own videos and my own animations. An RNFL defect I've superimposed and showed structure function correlation by showing the same patient's fundus and visual field, putting the OCT on the fundus, reducing the transparency, and showing the RNFL defect and the ganglion cell layer defect. So I've covered 6 points in a single minute for a neophyte who's starting his journey in the field of glaucoma. And I'm more into a video-based curriculum that I started, and I started publishing my videos as well. So to show a few more videos, ALT versus SLT spot size, argon laser peripheral iridoplasty, where you pull the iris, which is a oppositional angle closure, where you can actually pull the iris and it opens up. And the same, can you show it from a front-on view? That is also possible, right? Only a cross-sectional view or a front-on view. So my mind changed from videos itself. Can I approach it from a gonioscopic view? A front-on view, a cross-sectional view, a gonioscopic view, and I was still making a lot of videos. I was not really pushing the boundary further. That is when I was more into YouTube and publishing all my less is more videos of 1 minute each, and I started making a lot of unanimated models of circle of Willis, YAG-PA, and we also got it printed, which I have it with me, which I can show it at the end of the session as well. So these are the eyeball models, the circle of Willis, and you see, you name it, we have printed all these models for the benefit of teaching all the pathologies, myelinated nerve fibers, splint hemorrhage, new vessels, and then was when I cracked augmented reality. So I was able to crack augmented reality in a smartphone using the LiDAR technology, where on day one in medical curriculum, you see on the right hand side, this is the camera view which is actually seen in the mobile camera. And left hand side is the real world scenario where the pedagogue or the teacher is trying to move his phone and he's orienting the neophytes on day one to what structures actually a retinal surgeon may see or a glaucomatologist may see. And that is one presentation I did in TNOA in our state conference 2021. I was able to extremely show all these structures, and that was when I met Professor Nadarajan sir, who saw this model, he evaluated this, and you can see again, this was one demonstration I did to him in 2021. Even the pathologies, you can choose the filters you want. You can see the beautiful RNFL defect, autofluorescence image or an infrared image, and I also published it. So that was when I met Professor Dr. Nadarajan sir here, and he immediately took me to Bombay. So I was not having a clear aim, and you can see me, I was with a beard at that time also when I met sir in 2021. And he took me to Bombay. He immediately told me, can you come tomorrow or maybe next week? I told sir, I can even come today. And I immediately booked my tickets. I went to Bombay. Sir took me personally to help me see lab, and he gave me the path as to which path I have to go. And I immediately connected him to my team. Some of them are here. Dr. Anugrah is here from my team. And I was able to shadow him the whole day. And then that propelled me to this innovation. I'm very indebted to Nadarajan sir because I was making the holograms, but I was not pushing them beyond a smartphone. Because after this trip which I had in Bombay, I was able to push the boundary, and I cracked the code for a HoloLens where you can simply wear this lens, and I'm just forwarding it for want of time. Maybe can I take a minute or more extra, sir? Yeah. So you can see that an angle resists the trabeculum meshwork pores. We started pushing the horizons. So you can see the anatomy. This is the maximum anatomy of the angle that you can get on not a 3D plane, but rather on a fourth dimension where you can also touch, examine the case sheet, feel it, and examining the case sheet of a splinter hemorrhage patient here, where on outside you may think he's insane, but actually on the inside he's actually examining a patient on a 3-dimensional or on a 4-dimensional plane. So this I was able to crack after sir took me to help me see lab. I was able to rub shoulders with Doyences, and then that took me into a totally different era of multimodal imaging, low vision rehabilitation with this, and the whole neuro-ophthalmic anatomy, first neuro-ophthalmic anatomy model, we completely made it with this technology, and it is also available. We have, it's an offline app that we have launched for the benefit of students. And this is a whole museum that we have at our workplace in Trichy, where you name it, any anatomical structure, we have made it. And we are slowly pushing it into telemedicine as well. And now slowly we have started incorporating the filters, and then for posterior polar cataract, for example, an hydrodissection or a hydrodelineation, what plane should we do? For a diabetic retinopathy, can we incorporate the OCT slices into it? Because we tend to see it in a video where we scroll the mouse and we see, but can we extrapolate the data from each level that gives the exact precision, and before treatment, after treatment counseling, a striate keratopathy for that matter. So I can name a lot of structures that we have now crossing the boundaries on, AIOS2025-GP284-International, UBM, examining a cataract if you have an anterion which gives exactly every plane of that cataract. And that really pushes the boundaries for even a clinical platform. And this is a recent simulator where we have made it for MIGS, first simulator for MIGS in India, made by myself and my team. So this is just like the Johnny Quest, if anyone of you knows here, you are in the metaverse. I'm just going to take some more time. Yeah. So in the metaverse, you can actually practice this kind of simulative learning made in India, sir, under the guidance of Professor Nadarajan sir, and inspired by a few other stalwarts. So you can see a MIGS aspirant can train MIGS with this headset in a very economical way, and he can go place this stent multiple times and it turns green. This right available where not one time, two time, multiple times you can practice a surgery to refine your skills. So from teaching, we started moving into this. A lot of VR training where currently we are working on vertical chopping versus horizontal chopping, a simple thing. But that is what sir used to tell me when we made the animation for our claw instrument and even for one of the RDs. can you make something very simple, Prasanna? That is what sir always keeps telling me. And now we are slowly moving into these kind of cognitive tools, what a neophyte wants. And recently we were able to launch the 3D puzzle in India as well. So we printed the circle of Willis, we were able to print the cavernous sinus, we were able to do the complete automobiling of the eye, disengagement and engagement. And the last but not least is a subtractive tool that we have made. You can subtract structures that you don't want to see. For example, a neophyte wants to see only the optic nerve and he wants to trace the channel, and then he wants to see the video is not playing here. So basically the last part was adding the subtractive element. So they select what are the structures that they want to see and they choose what are the structures that they don't want to see, and we are trying to work it on a simulative module as well. I'm sorry for this, but then there is a small technical glitch in this. I'm not able to show this video. It's fine. So to summarize, we have made all these in real images. So that's the USP of these kind of modules that we are currently working on in India, and we are also grateful for leaders like Nadarajan sir, Devakant Mishra sir, the YOSI president, who identifies people like me when I started entering into YOSI, and they help us and guide us doing this, and these QR codes are all available for you to see. And I always feel we need to publish our work. That is again another thing that Professor Dr. Nadarajan sir keeps insisting. You can see the rejections are more than my number of acceptance in the PubMed indexed IGO portal. So we always believe in getting all our work published, and this is one journey of mine which really put me into timeless grit, self-determination, and I can just keep going, but I would like to end with this. So this is what pushed me through, and now I'm also mentoring people. I'm in a small way, I'm trying to do what Professor Dr. Nadarajan sir did to me. And we are also taking our work globally as how we Indians are getting all this technology. We are trying to collaborate with foreign KOLs, and the results are all showing. So thank you once again, sir, for giving this wonderful opportunity. So to network, to meet people, to show these innovations. And I'm very grateful for all the doyens here for this wonderful opportunity. So this is my timeless journey, which really put me. And I would also like to acknowledge my team. So this is a team which I built, where I and my sister, we both are doctors. Again, we have one Dr. Anu with us who's in retina. And these are my team which really works day and night. And we now have our own startup registered. I was a small guy making films with a simple video camera. Now our startup is called the Mahatma Center of Moving Images Private Limited. And we are taking it in a very big scale. And this is holograms that we are trying to push, not only for teaching, counseling, but also for diagnostics and for precision in a cognitive scale. So last point is the leadership point. This helped me again, put me on leadership, where I'm again blessed to be with dynamic leaders here like Devakant sir, Nadarajan sir, where I'm currently the joint secretary for YOSI, and I'm currently also in the APO leadership program, which is graduating on Saturday. So this is my journey. When sir asked me to talk about my journey, I told sir, I'm quite young to talk about my journey, but he told me you talk about your innovations, and I want to show what is that, how you started doing it. So it was always an image, which was always science fiction. When I saw the Avengers movie in 2010 with Iron Man doing all his Java stuff, I really wanted to do it, but I didn't think I was able to do. But science fiction is not more a science fiction, it's a science-based reality. And I'd like to thank Nadarajan sir, because the 2021, when he found a person from Trichy is a tier 2, tier 3 city, and he took me to Mumbai, and that really paved the way for a lot of this. And thank you once again for giving me this opportunity, sir, in this ICO session. Thank you.
Thank you, Prasanna.
Thank you so much. Can you hear me? I'm not sure if the mic is on. Yeah, thank you. Are there any questions? It was a fascinating talk. The speed of slide change was so
Yeah.
overwhelming, but there may be some questions. If not at this point, we can always come back to it by the end of this session. And it's my great privilege and pleasure to invite Professor Natarajan now to speak about his observations and experience in how to excel as ophthalmologist and in leadership in several societies. Thank you.
Thank you, Yuval. And one comment on Prasanna is I always like to keep learning. That's why I keep growing young. So one day I'll be a fellow to him because I keep telling him to work with this. Please sit down. And then he made a beautiful video on my claw forceps using a new technique for removing the foreign body, which I thought you'll show, but it doesn't matter. But I think we have to do several. I know, no problem. But we have to do several things for teaching. But retina is my passion. I only breathe in and vitreous and retina. So I know this story I like to share because I all my humble beginning is from Madurai. I was born in Madurai, which is a historic temple town in southern India, where Arvind Eye Hospital was born. And Dr. Venkateswamy always said, when the 7th century, the Madurai temple was built by 3 kings, why not, where is that intelligence, and why not we bring it back to ophthalmology? And that's how he started Arvind Eye Hospital after he went to the Arvind Ashram. So this is my parents, who is no more, and my mentor, Dr. Badrinath, who made me whatever I am today. And Shivanandan is my best critic and my lifetime coach, who is with me all the time. And then finally, God. So this is just to show the picture where right from childhood, I don't know how, I was wearing tie all the time, and I was the only student wearing as an undergraduate tie, and that was made me prominent. But and also, you can't be naughty and you have to be answerable to the professor. So many times, I think, I don't know how it happened, but I wear tie, and I think continuously I like to dress well. The idea is to bring in good energy. This is my grandparents, my mother's parents, and who are there. She lived 102, and she's my inspiration. She didn't probably, those days she studied in school where only in the sand they used to write, that I'm telling in 1930s, I think. And then you can see, like she was my inspiration because she was having excellent eye-hand coordination for what we call as a kolam or a rangoli, where you put dots and connect it. And this is my parents who gave me the education. This is a photograph taken in the government ophthalmic hospital quarters, where my mother gave me all the love and my father gave me education. And I think my father was a tutor at that time, and probably he didn't do private practice. He was a tennis player, so he was like a good ophthalmologist, but he didn't do private practice. So again, this is my school days with my brother, again wearing tie. And this is I was an athletic captain, and this was a long distance running. I did 10 kilometers, 5 and 1,500, and 4 into 100 and 4 into 400 relay. And now I don't like to run because I'm in the gym, but I don't like to run. But my thing is, I think a sound mind and a sound body, that's what the Olympic motto. And I think we have to have stamina, particularly to do long vitreoretinal surgeries, because sometimes we operate from morning to night. And my father and grandfather were part of the government Tamil Nadu. That time my grandfather worked in the Madras presidency, right from Kanyakumari to Orissa. And then we lived in the same house in different time period in the government ophthalmic hospital quarters, which is the second hospital in India. This is the government ophthalmic hospital, and I lived in this quarters from the time I was born in Madurai till 1969, 12 years. I used to put torch for my father to even remove the foreign body. That time it was a lot. And then my father's teacher taught me parts of the eye when I was a 5-year-old, and then that's how I decided to become an ophthalmologist. And I also was inspired by that visionary V.G. Panditadas, who believed that if you have a dream, you said convert the dream into a prayer, and he said you tell the prayer daily. And my prayer, without realizing what it is, because I've seen a lot of foreign faculty coming and meeting my father and in the hospital, and I decided that I should become an internationally renowned ophthalmologist from the age of 5 without knowing the real meaning, but it happened. And this is my medical college fee, which is about 300 rupees, something like 3 euros I paid a year for that time to become a doctor. And then I also completed my postgraduate and joined Shankar Nethralaya, which was the premier institute, even now #1. So I have my mentor, Dr. Badrinath, who made me whatever I am. And the second mentor is Ralja Jovanovic from that time Yugoslavia. Now he's part of Montenegro. He lives in a city called Herceg Novi, where the First World War started in 1911. and he's 94. I'm planning to visit him, but he taught me because he started his ophthalmology at the age of 33 and he retired at the age of 65, and he was always doing gardening, and I used to take a lot of plants from Mumbai. I know it was not allowed, but I used to take, and he's got a garden with a lot of crotons and the other plants and in his house in Montenegro. And he was a great surgeon who revolutionized vitreoretinal surgery using silicone oil. So sometimes they used to call him a nickname as Silicnovish, but he always told me that how to approach any vitreoretinal problem, and I think he really revolutionized vitreoretinal surgery and all complex trauma patients, which I'm operating thanks to him for the training. So this was in 1990 I started AIOS2025 because in 88 I went to Bombay Hospital and started the vitreoretinal department, and that time nobody was doing vitreoretinal surgery, and but since the hospital did not give me enough, then I started the AIOS2025 as an exclusive vitreoretinal center, which was not known any time like that. This was the ground floor of a building I converted into a eye hospital, and I wanted everything in vitreoretinal surgery, which I did. And I was also a founding member of the Vitreoretinal Society of India along with Dr. Ursekar and Dr. Jahangir, and now it has grown to 2000 vitreoretinal surgery members, and I also finished the president of Vitreoretinal Society in 2010. And so I follow Gandhiji, and he says, you must be the change you used to see in the world. And I decided that a hospital should not look like a hospital, and that's how I made AIOS2025 Hospital. And true progress has to be defined to maximize on what you have is progress. And this was the vision was dawned in 1990, and I started this AIOS2025 Hospital. So main thing is he's a spiritual leader from Bangalore. He became a good friend, and he said, what are you doing for others is important. And that's why I even quote Swami Vivekananda, who says, they alone live who live for others, and rest are equivalent to dead person. That's the theme which I'm doing now, where I want to serve more and more people. So from a small building, we went into this in 2004, and I think most of the vitreoretinal surgeons of the world have visited Dadar and Wadala, and then I got this Padma Shri in 2013, and this is my Shivanandan, who so here we started as a vitreoretinal, but later because of the demand I had to start everything in ophthalmology, so we have A to Z, and this was the one Dr. Badrinath again inaugurated in 2001, the LASIK, and you can see our past president Dr. Quresh Maskati in the picture. So this is what I converted Gandhiji's statement. He called it for a business. He said a customer. So I made it a patient is the most important visitor on our premises. He's not dependent on us. We are dependent on him. He's not an interruption in our work. He's the purpose of it. He's not an outsider in our business. He's a part of it. We are not doing him a favor by serving him. He is doing us a favor by giving us an opportunity to do so. You can imagine the patient lying down on the operation table, totally trusting you, because at that time we have to do the best for him. And at that time the Chief Minister inaugurated the new building in 2004, and then we had Aishwarya Rai as our ambassador for eye donation, and she inaugurated the AIOS2025 Eye Bank. The reason I'm showing all this is Dr. Kalam as a president visited us, and it was nice of him because he was a very great friend from before he became a president. Dr. Badrinath introduced me, so I told him to visit us, and he came. There was no function, but he just came to visit us to meet all the staff, and I said, whatever I enjoy, I wanted my team and my family to enjoy. You can see my son and daughter there, and it was nice of him. He keeps coming. He has come several times as a president, and later after becoming a president also to visit me and encourage. And he always tell you should do something. And Dr. Prasanna, he always told me, you are a big man in retina. What are you doing for glaucoma? He used to ask me, and I'm happy that we have that. And we also made a lot of programs with various film celebrities. This is Selina Jetli talking on the eye donation on one of the anniversary. So I started like this in 2004, and now in 2025 we have again remodeled with the Agarwal group of eye hospitals. And this is again he inaugurated a van because my dream is to serve all the poor people of Mumbai. And I made a foundation called Sundaram Natarajan Blind Free India Foundation. The reason is to work from Kashmir to Kanyakumari and work from Arunachal Pradesh to Kutch. That's my length and breadth of the country I want to serve, and one man cannot do. And I know I want to interact and do. And this was the one of the first things we introduced in 2014, thanks to K. Chandrasekhar, the CEO of Forus. And you can see my grandmother at that time she was 99, and she inaugurated this van. My father, late father, also ophthalmology is there. This is a Forus camera. We used to take it in the motorbike and go all over Mumbai and serve, and also the villages. And we celebrated the life of Dr. Badrinath, Dr. Namparamal Swami, and Dr. Nagpal, who celebrated 75 years, because that's we called it Guru Vandana. The idea is to get blessings from the teacher. And I was glad, that's why Dr. Badrinath used to tell me, what did we do to become the 242 chartered inductees, because you can't apply, there's no application. And in 2016, this is starting from the 18th century, from Von Helmholtz to Alvar Gallstrand, the only guy with Nobel Prize, and thanks like Jules Gonin, Carl Stargart, the Ernest Custodis, Charles Keepens, Roger Jonovich, Harvey Linkoff, and you name it, they're biggest Ratna people, and I'm happy to be with them along with Dr. Badrinath. And we also started a genetic lab. The reason I'm telling all this is I came as a outsider from Madras to Bombay that time, and now it's Mumbai. And I think where there's a will, there's a way. And this is a genetic lab. Now we have shifted many places, and I'm making a new lab in Chembur. And we are now, I'm the vice president of Global Eye Genetic Consortium, because the research is in my back of the mind all the time. And you can see Dr. Takeshi, who's the current president, who will be probably I will take over from him shortly. The idea is to bring gene therapy to this part of the country. And we also started optometry school, DNB, fellow national board fellows. So the idea of 7 6 of success is I found the answers in my room. The roof said aim high, the fan said be cool, the clock said every minute is precious, and the mirror said reflect before you act, and the window said see the world, calendar said be up to date, and the door said push hard to achieve your goals. And I always quote these two books by Robin Sharma. Robin Sharma's brother is a vitreoretinal surgeon in Canada, the monk who sold his Ferrari, and the Greatness Guide. And the reason is, and I think it shows a lot of things what you need in life. And there, one of the answers given is how to, like he says, remove fear from life, you start growing young. And that's what is the lesson I said. And so there's no fear for anything for me. So I always believe in positive thinking, smiling and standing tall up, emphasize positive thoughts you have, and it will reduce stress and improves self-esteem. And the problems of life are not really out there, they are in here in our mind, and everything is decided in and by the mind. So Paul Coelho said, when you want something, all the universe conspires in helping you to achieve it. And that's what I wanted to encourage people like Prasanna. The reason is, everybody has a potential, and potential, nobody realizes what they can do. And I mean, whether it's a Napoleon Bonaparte or whether it's the Alfred Nobel, everybody had the same, whatever you have, everybody has, but the thing is how to use it. And so when you want something, all the universe conspires in helping you to achieve it. And that's what I think I have started even though my father was a government servant, he didn't have much money, but he gave education. But from whatever I am, and I think what to reach, I think it's all in your mind. You have to decide. And I recently met Dr. Kripali in the program called Millionaire Mind Intense, and that before that I attended a program called Success Gyan. Somebody, my best friend critic Shivanandan, said, why do you want to attend all this at your age? And I said, the age is not it's a number, and more important is, I want a foundation and I want to earn something like 1,000 crore, not for myself, for the people of India. And I want to bring latest to all the villages. We have 6,47,500 villages, and I want to serve all of them for eye care. And so main thing is to follow your dream, and I think you have to, this is my appeal to all the young people, go ahead and live your dream. whatever may be the dream. And I think that's what I learned in all these programs, and I always attend these programs which is not part of ophthalmology, and I'm glad I learned the leadership program from American Academy. I'm indebted to my mentors there, which I did in 2004-5, and I'm from 2006. I'm doing it for all India, and it's a great program. And later Asia Pacific has started, and I'm glad Prasanna is now student. And these are some articles in the press to say how you are from an ordinary background, still you can grow with whatever you want. And a leader is one who guides and directs other people. A leader gives the efforts of his followers a direction and a purpose by influencing their behavior. That's what Louis Aller said. And thus, leadership is an ability to direct and motivate other persons in organization so that they may contribute their effort towards the success of organization. And for me, India is my organization, and inspiring excellence in ophthalmology, and that's what I want to do. So these are some of the things which I played leadership role, and I think you have to have that fire in your belly to do all this. And right now I'm the treasurer of the International Council of Ophthalmology, thanks to EO and Dr. Neeru Gupta, who is guiding us, and we want to lead the world. And one day, when there's a chance, I want to lead and go. We have, I think, 183 country members, EO. We have 183, so hope to visit all the 183 countries as a part of the ICO. And I mean, these are the lists, and I always impressed with the Prasanna. In his young age, he has got 195 peer-reviewed publication, and in 12 years of ophthalmology, which is amazing. So, my journey continues, because I was the editor of Indian Journal of Ophthalmology, and previously it was called Publish or Perish. That means that was that motto, and I changed it to Publish and Flourish, and that was my motto in IGO. The reason flourish is when you publish, people will read, and it will be eternally available now with the online and everything. The reason is people have to read, and then probably even if when you're no more, I think people will follow the science, and that's what is our contribution. And then these are the various publications. So great leaders were not born great. They made themselves great by observing their surroundings and doing their best to change them. And that's what I have done. I think I was an ordinary playful child, and maybe till the age of 5, I was a crying child. Thanks to my father, I don't know what he did. He even had a tuition teacher, not for studying the regular course. We had 4 museums next to my house in Egmore in Madras, where he had a teacher to teach me each museum, what are their contents. And I was like a tourist guide for my family members and friends who come. At the age of 7 to 8, I used to walk with them and show this one. I think it's helpful. Now also, I take all my friends. Recently, we had Ferenc Kuhn and William and Dr. Schrader from Germany. So I am the tour guide. So I do go see, every time I learn something about Bombay now, and walking tour I do. So the idea is, I think, never think of the past. That's what is the spirituality. It's supposed to bring, maybe to bring tears, and don't think of the future. It brings fear, and live this second. And so that's why yesterday is history, forget it, and tomorrow is mystery, nobody knows. But present in English, the other word is gift. So this moment is a gift for all of us. So learn to enjoy life 24/7, and fast should help you to see what struggle you had instead of keep grumbling. And I was like this. I was born in this family, and I am from a village. I'm from a rich family. All that is. I always recommend that book, The Magic of Thinking Big, by Howard Schultz. He says that there's a chapter called Cure Yourself of Failure Disease Excusitis. What is that? It says, I'm too young to do this, or I'm too old to do this. So everything I think is probably you should. So I follow this 5 P's, which is like 4 I borrowed from Shamak Dawar's Yes Dance group. Shamak Dawar is a good friend. Perseverance, perfection, patience, prayer he had in that. As a vitreoretinal surgeon, I have added precision. And the last one, which is not there, is passion. I think passion drives you to do whatever you want. And this is there in our scriptures 1,000 years back. Yat bhavam tat bhavati. You become what you think. You decide what you want to, and you become. And the world is manifestation of our inner state. perceived reality eventually becomes manifested reality. We perceive a thought containing a change or emotion. The process of creation is set into motion. An arrow has been released into ethereal planes or thought sphere. So even for a second, I think you should not think fear can come. So you have to learn to remove that. So best is everybody has a lot of negative thoughts which you have to convert in either by chanting or only thinking good, and never think that how can I do it. And I think I'm able to achieve whatever I am dreaming from the age of 5, and it may not happen in maybe some things have still not happened. I'm 67 plus, but I think it will happen. I know. And I said if I live 33 more years, I only want to serve the poor people of India. And this is a hospital which is the second next to Moorfields. This was started in 18 and Moorfields was 1819, and Moorfields was established in 1805. And this is still standing, 206 years, and I'm glad All India Ophthalmic Society celebrated 200 years of modern ophthalmology in India. And I think you all know Trushita did the first cataract surgery 600 BC. And this is the first and the biggest museum in ophthalmology in the world, bigger than any of them. And now I think in Nantong, China is building a 10-floor building, but still this collection is beautiful thanks to the Britishers who started in 1919. Thank you very much.
Thank you very much for this inspiring talk and sharing the wisdom. There was a lot of wisdom in this presentation, and I would just like to relate to those who have been around a little bit for some time, and we were privileged to be put in leadership positions. We can see that wisdom there. Thank you so much. And for those who are a little bit kind of starting their career, I would like to encourage you to listen really carefully to the advice, because it can actually speed up your life so significantly. You know, many of us have been, shall we say, excellent surgeons and excellent clinicians, but the mastery of how manage to grow in life, to grow in your career, to be a leader eventually, it's a totally different cup of tea.
Yes.
It's a very different from learning, you know, clinical stuff. So thank you so much. I was really very much impressed by the discussion. And now it's time for questions. I believe it's the last question.
No, we have one more.
Because it's not listed here. So
It's here. No, it's not there. Okay, anyway,
yeah,
she's there.
it's not listed
So we
here,
have
so
half an
sorry,
hour.
yeah.
No, I will introduce her. So thank you, Ivo, for your comments, and I am happy, because I keep presenting it to know how to lead. Now I one day want to lead the world with your help, and hope to do that. And with this, it's not a boasting lecture, and the idea was to stimulate young people, because I was an ordinary student, and then later I was a college general secretary, and later when I became an ophthalmologist, I wanted to be the best, and all the time to be the best, and I think we are able to achieve. The idea of being the best is to serve people, and whether it's a patient or organization. So with this, next I invite Dr. Kripali Sheth, and I met her, and she's an ophthalmologist and a refractive surgeon, but more than that, she's now my mentor in mindfulness, and I think instead of she herself will now start a session. And she did a wonderful session with our staff, because now I'm making a new organization in the sense to serve poor people. So I want them to have the same vision and mission what I have in my mind, to give it to my staff. Thank you, Kripali.
Thank you, sir. So at the outset, I would like to thank Dr. Natarajan, sir, AIOC, and Dr. Ivo for giving me this opportunity. So how many of you have ever felt stressed, exhausted, or burnt out in your medical career? Show me with a raise of your hands, please. Thank you. Thank you for your honesty. Thank you, sir. You're not alone. Over 50% of doctors in the medical profession, they go through burnout. And yet, we are taught to just push through. But what if I tell you that a simple change in the mindset and mindfulness can help you release this stress? How many of you have ever thought or questioned that why, being a medicos, we are never taught how to handle stress in the medical schools? Show me with a raise of your hands, please. Thank you, sir. Thank you. Thank you. Did you know that studies show that over more than 60% of doctors, they go through emotional exhaustion. And yet, we continue working in stress, just thinking that it's a part of our job. So first of all, let me tell you, thank you. At this point of time, you could be attending any of the sessions in various halls, but you still chose to be here. That really means a lot. So thank you once again. And let me also acknowledge the reason why you are here is somewhere deep within, you believe that there is a leader within which needs to be awakened. And that's why you are here. So we are going to spend the next few minutes together. So is it okay? Can I share something that who am I and why I am doing this? Is it okay? Can I have your permission? Yes, thank you. A few years ago, I found myself completely drained, both physically and mentally. I was constantly exhausted, having sleepless nights, and my passion for my work was fading. I thought that this is just a normal life of a doctor, until one day I hit the breaking point. And I realized that no amount of external stress or external changes, that is more coffee or more vacations or reducing my workload, could fix the deeper issue within. The real problem wasn't just the system, it was within me. And that's when I discovered the science behind mindset and mindfulness and how it can reduce stress. And I started studying about mindset and mindfulness because I was in soup. And I learned that stress isn't just caused by the external situations, but how our brain processes them. And the best part was that we can rewire our brain, and thus without sacrificing our happiness. And because of that, I started seeing changes in myself. I was calmer during the stressful patient encounters, more present in my life, and I rediscovered the joy of giving vision to people. And because of that, I realized that this wasn't just about me. When I was less stressed, my patients felt it. My colleagues noticed it. And I started sharing these techniques to doctors who began experiencing the same transformation. So this wasn't just a theory, but it was a game changer for medical professionals worldwide. Over the period of 2 years, after helping hundreds of people live a and life and not an or life, I am here, Dr. Krupali, a cataract and a refractive surgeon practicing in Mumbai, and a mindset and a mindfulness coach on a mission to help 100,000 people to live a happier and a fulfilling life. My heart couldn't settle for less because I recently saw that, there were many doctors committing suicide. I was just speaking to Dr. Natarajan sir about a young chap who had 200 PubMed publications, a dermatologist, but he recently committed a suicide. Yesterday, I saw news that a girl pursuing DM and on the verge of giving entrance, but she gave up on her life because she could not handle stress. And that's when I spoke to my mentor, Blair Singer, that Blair, how can I manage both my professions? Both are my babies. I love giving vision to people and I help people live happily. He said, Krupali, you know what is greed? He said, greed is having a gift and not sharing it with the world. So that's when he connected me deeper with my purpose and my calling, that Krupali, just go for it. And as Dr. Natarajan sir just rightly pointed out, as what Paul Coelho said, that when you desire something, the entire universe conspires you to give it. So let me ask you one question. How many of you have kids or you have been around kids? Show me with a raise of your hands. Thank you. So, how many of you know that who wins when the kid is at the highest energy? Who wins? It's either you or the kids. Kids, right? Thank you. You know why? Because it is said that highest energy wins. Highest energy wins. So just imagine if I'm here and I'm talking, hi, my name is Dr. Kripale, and I'm going to talk about mindset, and there are 50 slides and 20 pointers each. You would just run away, right? Because that's too boring. And that's when, how many of you would require, would desire to have more success and happiness in your life? Show me with a raise of your hands. Thank you. How many of you desire to earn a lot of money? Thank you. And you know what these things require? They require energy. So learning requires energy. Learning requires what? Energy, yes. Thank you. So I'm going to talk to you about how mindset and mindfulness can help you reduce your stress. Let me tell you, this is a scientifically proven and evidence-based science. But there is one problem. This model is fail-proof, but it has one problem. You know this organ over here, brain? So let me ask you one question over here. What percentage of decisions do you take consciously? Can you just shout out, please? Yes, consciously. What percentage of decisions do you take? How much, sir? 80%. Sir, I'm sorry to tell you, and you will be disappointed to know this, that only 10% of your decisions you take consciously. So what is it about the remaining 90%? The remaining 90% is your subconscious mind. It has all your thoughts, your patterns, your beliefs, which you have acquired from your parents, from societies, from teachers, and from media. But, this subconscious mind has one characteristic. It has a little voice. The little voice which says, I am not good enough. I cannot do this. Or I am not worthy. Or I am not ready. How many of you have ever had such small little voices which stops you from preventing the next goals? Thank you, ma'am, for your honesty. So is it okay if I share you some tip that how to lower this, the little voice which stops us? Is it okay if I share you? Yes, thank you. So how many of you here watch some kind of sports? Thank you. And so what do players do when they win? They celebrate, right? They celebrate with high fives, they hug each other, they lift each other's, right? So it is said that when you celebrate your wins, even if it is the smallest of the wins, you lower this little voice which is stopping you from achieving success, right? So with this, I would just like you to turn around to some person next to you. I know there are many empty chairs, but turn around, just give them a high five, and just remind them that celebrate your wins. Thank you, thank you. But this is not a normal, talk. What I would like to request you all is to be 100% active and participate. And stay till the end, because at the end, we are going to do a beautiful mindfulness practice, and you can experience the magic. And can I share you one difference, which is there between a highly successful and a fulfilling person and a person who is unsuccessful? Is it okay? Yes, thank you. So, really a successful person, he takes 100% responsibility of their actions. For them, there is no blame, there is no excuses, and there is no denial. They take 100% responsibility of their actions. So as you have agreed that you would participate 100%, so what I would like you all to do is, these are the different areas of your life. So just rate yourself, even in your mind or maybe in your notes in your phone, that how much would you rate yourself, with 1 being the least and 10 being the highest? In career, money, family, health, spirituality, and relationships. Could you all please note down? Thank you, ma'am. Thank you. Yes? So with this, what I would like to show you is that this is a wheel of life. So just imagine that if a person is highly successful in his career, in his money, but his physical and mental and emotional health is at toll. What would happen? He wouldn't be able to live and enjoy his life completely. And on the other hand, if the person is extremely fit, but his finances are haywire, he would still be unhappy, right? And so I would request you all to, that after every quarter of your, life, after every 3 months, just go and visit that which area of my life needs more attention right now, because the wheel has to be balanced to live a happy and a fulfilling life. In healthcare, the burnout and stress are at an all-time high. And 50% of the doctors suffer with burnout, and which leads to poor patient care, medical errors, and dissatisfaction. So let us see what WHO defines burnout as. It's nothing but a physical and a mental exhaustion where one becomes cynical, negative due to chronic stress. So these are the various stages of burnout, where eventually the patient at the 12th stage just may collapse or have a physical or a mental breakdown. Now let us see what is stress. Stress is nothing but an autonomic nervous system response activating your fight and flight response. And this chronic stress, it increases the cortisol, the adrenaline levels. It impairs the prefrontal cortex, which is the cognitive area where the thinking happens, and it weakens the immune system. So let us see that, as a men and females, what all roles do we play in our life, right? The men over here, we play a role of either entrepreneur, employer, employee, father, son, husband. And female friends over here, either way, you play a role of mother, wife, daughter, daughter-in-law, apart from being a doctor, right? So there are many areas which causes us burnt out. Yes, sir, son-in-law. True. Thank you, sir. So let us just see that what are your biggest stressors at work? How many of you think that you have long working hours at work which leads to stress? Can you please show me with a raise of your hands? Thank you, ma'am. Thank you. How many of you have or have experienced toxic work environment and hierarchical pressures? Thank you. Thank you. And despite of working hard enough, you've never got that support or recognition. How many of you relate with this? Thank you, ma'am. Thank you. Or how many of you have felt that you are sleep deprived? Thank you. And lack of work-life balance? Thank you. Thank you. So the solution here is mindset and mindfulness. So let us see what the scientific evidence behind mindset says. A study in JAMA in 2021 found that physicians who experienced or who went through mindfulness reduced their burnout by 30%. And Harvard Medical Study shows that a positive mindset enhances resilience and cognitive flexibility, thus reducing stress. So what is mindset shifting? Okay, our brain has a unique capacity of neuroplasticity. Our brain rewires itself based on the repeated thoughts and behaviors. So, like our senior professors would agree that few years back we had studied that neurons, they don't develop, or this concept of neuroplasticity was not there when maybe Dr. Natarajan sir, Dr. Evo, and Dr. Kumar would have studied their MBBS, right? But now the scientists have found that the brain has a unique capacity of neuroplasticity. The negative thought patterns, they create a certain neural pathways which reinforces stress. But a wonderful study by Carol Dweck suggests that when you shift from a fixed mindset to a growth mindset, it enhances your problem solving and emotional regulation. So some of the few practical strategies which I would like to share with you are, first of all, is cognitive reframing. Our words have a lot of power. Whatever you say after I am becomes reality. So be very, very mindful that what are you saying to your own self. If you find yourself or your loved ones constantly saying that I am exhausted, I am tired, You know, the stress has become that new trend, like Ghibli trend, which is coming right now, right? The similar way, every other person you meet and they say, I'm stressed. And what are they inviting? They're inviting more stress, right? So just reframing your words that I am exhausted to this is a challenge and I am learning to navigate it. Just think, it's more empowering, right? So anything what you say after I am becomes the reality. So if you don't take anything from this talk, I would just like you to go with this one thought, that be very, very mindful. What are you saying after I am? Second one is gratitude. Gratitude is nothing but being thankful for what we have. It is wonderfully said that gratitude and dissatisfaction cannot coexist. You can be either dissatisfied in life, that is unpeaceful, or you can be grateful and peaceful. So a research from UC Berkeley shows that gratitude improves your mental health by activating the happy hormones, that is dopamine and serotonin. So let me ask, what was your first thought when you got up today this morning? There are many people who didn't see this morning, and yet we take our life for granted. We don't know from where the next molecule of oxygen which we are breathing, but it is freely available. We don't know, so many friends over here have left their kids and their spouses at home, including me, and they are taking care of the family there, and I am here, but we forget to thank our loved ones. We forget to give thanks to what we already have. So it is beautifully said that when you keep counting your blessings, or when you are grateful for what you have, you get more things to be grateful for. So can I have a moment over here? And just each one of you, just close your eyes and just count your blessings. Just think of any 5 things, person, or situation that you are really grateful for. And you're counting your blessings, so I think a smile on your face would be wonderful. Thank you, Dr. Prasanna. Thank you, Dr. Evo. Thank you, sir. Yes, thank you. And the third is that when you shift your words, how many of you think that every day you have, I have to-do list, right? I have to cook, I have to send my kids to school, I have to make their tiffins, I have to go to my clinic, right? But what if instead you shift your I have to I choose to. I choose to go to work. I choose to make my kids tiffin. I choose to, it just soothes your parasympathetic nervous system. So just by a simple shift in words, you can rewire your brain into less stress and more positivity. So take one moment here and write down, or just note it down, that what is one belief that you want to let go of today? Do you want to let go that I am constantly stressed, or I don't have enough time? And reframe it to a positive, empowering one. The next strategy is mindfulness. So what does mindfulness mean? It just simply means that staying in the present moment. And as Dr. Natarajan sir beautifully said, that when you think about your past or about your future, you are not living the present moment, which is the real gift. So mindfulness simply means to stay in the present moment. So how does this mindfulness reduces stress? It lowers your amygdala activity, which is nothing but your emotional brain, which reduces fear and stress response. It strengthens your prefrontal cortex, and thus you are able to take better decisions, and you're more focused. And it increases gray matter density, which improves your cognitive function and emotional regulation. So again, a 2016 study by JAMA showed that a mindfulness meditation, it reduces stress by 38% in the healthcare workers. And they also did an MRI scans about two group of people, and they found that one cohort which underwent 8 weeks of mindfulness practices increased their brain density in areas linked to emotional regulation. So here are the few mindfulness techniques. First one is the breath work. Mindfulness simply meant that you live in the present moment, right? So the first one is the breath work, wherein you do a box breathing. You inhale for the count of 4, you hold for the count of 4, you exhale for the count of 4, and you hold for the count of 4. So is it okay? Can we all practice just one box breathing right now? Right? Thank you. So just inhale at the count of 4. Inhale, 1, 2, 3, 4. Hold, 1, 2, 3, 4. Exhale, 1, 2, 3, 4. And hold on for 4. Thank you. This technique does not require you to be in a very, you can practice this in anywhere, even in your busy hospital or at your workplace or at your home, right? The second one is meditation, which is nothing but focusing on your breath. Even this, because what these mindfulness practices does it stimulates your vagus nerve, and so your heart rate lowers down, and it gives a signal to your brain that you are safe and everything is fine. The third one is a grounding technique, wherein wherever you find yourself stressed or constantly the thoughts are running out in your mind, what do is you identify 5 things that you see, 4 things that you feel, 3 things that you hear, 2 things that you can smell, and 1 which you can taste. And the last one is nothing but taking mindful micro pauses, nothing but of 60 seconds, and focusing on your breath and bodily sensations. So can we all just relax, keep your phones and everything aside, and just close your eyes. Sound, please. Just relax and close your eyes. And take a deep breath in and breathe out. And slowly, as you breathe in and relax, feel your body and your mind completely getting relaxed. And continue taking deep breaths. And just bring to your mind 3 things that you are really grateful for. And slowly, whenever you are comfortable, open your eyes with a smile. How was it? Thank you, sir. How about you? Thank you. So what I would like to conclude here is that we are taught to prioritize patience over ourselves. And stress, as we know, it is inevitable, but suffering is optional. A small shift in the mindset can make a huge difference. And mindset and mindfulness, these are scientifically proven to reduce your stress and enhance your cognitive function. And mindfulness is not just about sitting in long hours for meditation. It is just about being fully present, even in a busy hospital or at home. As I just told that, we spend our entire lives healing others. But let's start by healing ourselves. And we are taught to prioritize our patients over ourselves. But how can we heal others if we are running on empty? So I would like to request you all to practice any of this one mindfulness technique for a week and just observe what changes are you noticing. And as Anne Lamott beautifully says that, almost everything will work again if you unplug it for few minutes, including you. What happens when our phone just gets hanged? We put off all the apps, right? And we shut it out for few minutes. And the same is with our brain, which has so many tabs opened up at one particular point of time. And with mindfulness, by being present in one moment, we are just reducing that stress. And even your own self will find yourself better when you just unplug it for few minutes. These are some people, who speak a lot about mindset and mindfulness, that how their life has changed. And Jack Canfield has beautifully said that it's the event. So E is events, R is response, and O is the outcome. The outcome that we experience in our life depends upon the response to the events and not to the events itself. The events can be the same, but it's always your response to the events determines the outcome. So this is one of the pick with all my mentors who has trained me for mindset and mindfulness. And last week, so last Tuesday we did, right, sir? Yeah, so last week I had an opportunity to do a session on mindset in Aditya Jyoth Hospital for Dr. Natarajan sir's team. I had no plans of doing this session. I was not registered also. But sir said that, Krupali, you have to come because you can empower so many young people who are going through stress. So my journey in this mindset and mindfulness began 2 to 3 years back when I was at my lowest low, and that happened when I lost my father. When I was questioning, God, why am I here? What more in life? And that's when the mindset and the mindfulness coach emerged. So that's all from my end. Thank you, Dr. Natarajan sir, Dr. Evo, for giving me this opportunity. And thank you, AIOC.
Thank you, Kripali. And I don't know, next session, who's the next session? Any idea? Nobody is here. Okay, any a few minutes. You are the next. You want to ask some question? You are the next session. Okay, a few minutes. Anybody wants to have any question or any comments from anybody?
Thank you, sir. Yes, sir. 60 seconds pauses. Yes. Yes. Thank you, sir.
So,
Absolutely, sir. So when you love what you are doing and when you're doing what you love, you no longer work. It's just your passion. Absolutely, sir. Yes, sir.
that's what Osho said, and you're following that. That's what Osho said. Yes. Yeah, exactly. I think we are all here because of the passion. Yes, please.
Thank you very much. You are very young. Not that you are not experienced, but you are very young, and that's my question is actually going. You know, during my time when I was doing my medical school and even after, we actually didn't have much guidance
Yes,
or
sir.
advice, even acknowledgement that medical profession is stressful, right? It was just not mentioned. It was like, I was just wondering if you have observed any development in that area in medical schools or postgraduate training, or you just feel it's not enough and we should really bring this knowledge and, shall we say, recognition of how the actual professional life is in our industry, shall
Exactly, sir.
professional life. What's your take on that?
Sir, so my journey in this began, I told you that I was at the darkest time of my life during my fellowship, and when I was not able to operate, my hands were literally shivering. I was in my scrubs, and there was an 80-year-old patient lying, and I was in my scrubs and I was crying. I had questions to God that, God, why did you take my father at the age of 60 when this 85-year-old gentleman is still alive? And that's when what I heard from, my peers and colleagues was that you just reduce her number of cases and allot it to somebody else. But nobody came to ask me that what is going on within me. And that's when, sir, I landed up in few books, courses, attended personal development sessions, and I found out that it is always beautifully said that to achieve anything in life, it's 80% mindset and only 20% skill set. But what I was doing wrong was I was just improvising my skill set. I was not working on my mindset. But the day when I worked on the mindset, when I got the results, I made a commitment with the God that, God, if you've helped me, I will make sure that I help as many number of people as I can. I spoke to my mentors, Blair Singer, and I just told him that, Blair, this is what I want to do. And like universe aligns right people. I just got in touch with Natarajan sir 10 days back. And that's when we discussed that, sir, I want to really help young doctors. Because I think if this, is brought in curriculum, or if, there is some extra program for this, we can save many doctors. Because my heart was not settling, Dr. Evo, when I saw that a person who has done 200 PubMed publications committed suicide. So what must be actually going on in his mind? Or a lady who is preparing for her DM committed suicide after achieving so many accolades. And it just doesn't feel right. And that's when I thought that, though with the little of knowledge and learnings which I have to bring it out and help as many people as I can.
Thank you. I think at the conclusion, I just want to quote again WHO, and I think as to answer your question, it is still not part of our curriculum even in India. Even though Medical Council of India, now it's the National Medical Council, addresses it. A lot of problems happening in undergraduate, postgraduate education. We are not taught the finance, leadership qualities, and also this mindfulness. So the WHO, which I remember reading as a medical student, even though it's there in WHO, but unfortunately it's not being practiced. The WHO Constitution states health is a state of complete physical mental and social well-being, which includes spiritual, and not merely the absence of disease or infirmity. An important implication of this definition is that mental health is more than just the absence of mental disorders or disabilities. And I think ICO can take something on this and keep spreading this message. Thank you, and thank Prasanna, and we already encroached the next session for a few minutes. Thank you very much, and thanks to APO and AOS for giving the ICO this session. Thank you.
Sir, would you like to have this, sir, which we did? Yes. Can we have the visuals, please? So this was last Tuesday where we did a session. And Dr. Evo, like not only doctors, but staff, OT assistants, each and every one of Sir's team was there. He's my husband, Dr. Sajeev. He's an orthopedic surgeon and a graphologist. And that's how we celebrated our win. So thank you so much. Thank you, sir.
Thank you, Kripali. Thank you.
Thank you.